Hello everyone, I am Dr. Mohal Banker, Interventional Radiologist from Banker's Vascular Hospital, and today we are going to discuss one interesting case of knee pain, and this case is treated by the advanced technique genicular artery embolization. So basically the genicular artery embolization is a broader form. It's called trans arterial microembolizations. It's called TAME. And this TAME, this TAME procedure is used for joint pain, any kind of tendinopathy, plantar fasciitis, heel pain, tennis elbow. There are lots of different kind of joint pain occur in our body, and in all these muscles and joint pain, this TAME procedure is very useful. Now we are discussing this case. This patient has a stage 4 osteoarthritis, and stage 4 osteoarthritis, KL grading stage 4, bone position, but the patient has a very severe osteoarthritis, and patient is suffering from chronic renal failure. His cardiac function is also very down. EF is less than 30%. So the two organs are already damaged. One is heart and second one is a kidney. And though the KL grading 4 advanced state, but patient cannot undergo such kind of knee replacement surgery, because in this surgery patient has to undergo lots of medications, anesthesia, and when the heart is not functioning very well, when the kidney is not functioning very well, so all these medicine loads or the anesthesia load cannot be tolerated by the patient, and that's why a patient cannot go for these surgical options which is advisable in grade 4. So now what's the next? Patient has to suffer the knee pain every day, and the patient come to us in Banker's Vascular Hospital, and we have performed this genicular artery embolization. So this genicular artery embolization is a non-surgical procedure invented by the Japanese interventional radiologist Dr. 𝙂𝙧𝙪𝙡𝙀, and we have started in India way back in 2020, and this procedure is done under the local anesthesia, and this half-an-hour procedure, and patient can resume day-to-day life from within a few hours. So because of the lower anesthesia and because there is no much medicines needed for recovery, this procedure is safe for such kind of patients who cannot opt for the surgical option. In this patient also, we have done this genicular artery embolization. Patient has knee pain, and we have done the genicular artery embolization. You can see the vascular blush on the angiography. This is a vascular blush, is the area where these abnormal cytokines is released within the knee joint, and these cytokines are the responsible for the chronic inflammation or arthritic changes for the within the knee. So we inject this small 45 microns particle, and these particles will actually stop the release of the cytokines within the joint, and that's why the inflammation reverse, arthritis changes will reverse, and that's why the patient pain will reduce. In KL grading 4, there may be chances that we cannot remove the complete pain. Patient may feel pain during the walking and standing, but definitely the pain score will reduce and patient's life become more and more comfortable. In this case also, patient pain is reduced, and now the patient's life is relatively more and more comfortable, and genicular artery embolization is a really blessing for many patients, those who does not want to go for surgery or those who cannot go for surgery. In both the category, genicular artery embolization is a really best option for knee pain. Thank you so much for listening to this talk. If you have any kind of question to ask me, I would be very happy to give you answer. Thank you.